Good afternoon, everyone. Welcome to the Alertus webinar series. My name is Sharice Ruan, Marketing Specialist at Alertus Technologies. During this presentation, Peter Lester, Healthcare Sales Manager for Alertus, and our panelists, Michael Ward, Director of Information Technology from Anderson Hospital, Daniel Anderson, Emergency Management Manager from Shawnee Mission Medical Center, and Bret Martin, Director of Fire, Life Safety, and Utilities from Carolina's Healthcare System, will provide insight on best practices for emergency communication in healthcare and the Alertus system. Feel free to submit your questions during the webinar at any time, and they will be addressed during the Q&A session at the end of this presentation. This webinar is being recorded and will be shared with you after today's session. If you have any questions after this presentation, please email marketing@alertus.com. Now I'd like to turn it over to Peter.
Thanks, Sharice. First of all, I want to thank our marketing team, and Sharice, you've done a wonderful job with this, so thanks for the time you put in to help make this happen. So, as the other presenters will do, I'm just going to say next slide, please, and then if you would just advance us so we can do the next slide. Thank you. So we're going to go, right to the Alertus Solution, because as the panelists will tell you, they had a lot of different issues and a lot of challenges in terms to consider. And the Alertus Solution is going to give you kind of a good glimpse as to what state-of-the-art alerting capabilities exist, and that they went through those considerations and selected those that met their immediate needs and schedules. So we'll do that, and then we'll talk a little bit about Alertus, because I think it's helpful to know a little bit about what we're doing these days and how long we've been around. We'll then get into the healthcare panelists. They each have a segment. We'll talk about that in a little bit. We'll move through this pretty quickly. There's a lot of good information to cover, so you all will have a bunch of useful takeaways. So we can go to the next one. Okay, so Alertus is one of the early players when it comes to mass notification as we know it today. The company was actually founded back in 2002. And for those of you that are not in the Maryland area, you probably would not know that tornadoes in Maryland are very rare occurrences, but one happened in 2002, which swept over the University of Maryland campus. It created a lot of damage and also loss of life. And the faculty and students and so forth were very concerned about being able to get alerts out should such a future event occur. And some graduate engineering students had some ideas of how to go about doing that. And the college made available all of the necessary resources to develop what is now the Alertus technology. It was spun off as a privately held company in 2002. It's been providing emergency alerting capability, and I have to tell you, I've been here for over 6 years. It just gets better and broader in terms of its capabilities, and we've been providing emergency alerting capabilities since that time. You can see in the bottom right-hand corner that we are serving multiple markets. Our first and our probably still our largest market is higher education because of the University of Maryland connection that we have, but we're very strong in healthcare, K-12, local government, military, DOD, kind of across the board. So we can go to the next, please. Thank you. Okay, so in healthcare, what we run into all the time, and you may share these challenges yourselves at your respective locations, and that is difficulty in reaching visitors and contractors. I can share with you that Johns Hopkins, who is deploying the Alertus system as we speak, in Baltimore actually had an active shooter going back almost 2 years ago. Getting the alerts out to their employees was not a big deal because they had everybody's cell phone number and or their email address. But the panic kicked in, and it really did kick in because of the public, the guests and visitors and independent contractors that were throughout their buildings. They had no way to communicate with them because none of their contact information was in any database. We've resolved that for them, and we will get into a little bit more of that a little bit later. There are going to be areas where you don't have any notification capability. This could be areas where you have no overhead paging. You may have buildings where there's no attendant in the building, and yet there are other people that may be passing through the building or whatever, and you need to be able to get alerts to them. You'll have, certainly in the healthcare world, we have people with special needs. and they need to be able to get these alerts as well. And then you may have some environments, laundry operations and others within the complex where there's loud noise, and they need to be able to get them. And then you have areas like OR where communication equipment, including cell phones, are just not allowed. And we can help you there as well. So we can go to the next slide. Thanks. Okay, so one of the things that we always like to try to understand early on is how are you able to send emergency alerts out today? What resources do you have? You can see on some of these, you know, it could be PA systems, it could be social media, things of that sort. What we do find in many cases is that most of the emergency management people that we talk to at hospitals are nowhere near where they would like to be. Some may not even have overhead paging. Some are using phone trees and things of that sort. And so what they'll wind up doing is looking at the Alertus Solution, and we'll move in a direction that will get them in much better shape very quickly. But we like to understand what your challenges are on a case-by-case basis, and we do that through an overview webinar that we would do separately. So we can move to the next, please. Thanks. The other thing is, of course, you may have some capabilities. You may be using an abduction system. You may have, you know, a phone tree, or you may have something else, but they're all disconnected. They're separate platforms, and by the time you go from one to another and get the alerts out, it can take up to 30 minutes, and all of you know, in a crisis, that just is not acceptable. There have to be ways to do this and do it much better. We can go to the next slide, please. What everybody's looking to do, and Alertus has had a reputation from early on as being a company that can really help you integrate your existing resources and add the Alertus endpoints to them. And the net result of that is that you bring this all together, and you have as an option the ability to activate all of your endpoints with one hit of a keystroke on your keyboard. So we call it single point activation, and everything you know, activates, and you really cover, you know, the entire enterprise. So we call that the easy button. We can go to the next one. Okay, this is kind of a busy slide. It's one of the slides that we cover when we do our overview webinar. You'll see at the very top of it at 12 o'clock, and I'm going to move to the left and go through this fairly quickly. The alert beacon, Johns Hopkins told us when we were doing our presentation to them that that device is a true breakthrough in healthcare communications. The reason being goes back to they were unable to get messages to any of the public, the family members, the guests, and all the others that were there. The alert beacon will be placed in large lobbies, cafeterias, long hallways, and you can see that there are several technologies built into that device, which is, by the way, 8 inches by 8 inches. They wanted something that would not be overly intrusive when it was passive, but they wanted something that would be very intrusive when it was activated. So you've got strobe lights on the outside of it. You've got real-time digital signage right in the center of it, which is very important. And then down below that screen, you can kind of see some circles. There's a built-in sound system, which you can control all the way from being muted up to 106 decibels. So this allows you to reach people whose contact information you don't have. To the left, panic buttons are growing in popularity in all of our healthcare clients, and we have quite an array of those that we discuss also in the overview webinar. The next would be desktop notification. For those hospitals that are really nowhere near where they want to be, desktop notification is a great step in the right direction. It's affordable, and you can get messages out across your enterprise workstations, or you can do it in a targeted way very quickly. We can hit various signs going further down, alert displays, LED marquees. If you're using VoIP handsets, we can use those by ringing them, creating an audible, as well as displaying the message on the screen there. The next one down is the Alertus app. The world's going mobile, so have we. And in our customer support package, we provide you the ability to send unlimited messages out to up to 10,000 users, and there's no additional cost to do that. To the right corner, fire alarm control panel interface. We're very lucky to have Bret Martin on from Carolina Healthcare. He's the one that actually got us into that business going back 5 years ago, so I'll defer to Bret to address that as we go. Just up above that, public address speakers. We have the ability to tie into your overhead paging system, and or just above that, outdoor notification. We have a number of hospital campuses that in better weather, family members are outside with patients. They need to be informed, and we have state-of-the-art outdoor notification. We introduced it several years ago, and to my knowledge, it's kind of taken the industry by storm. We've never lost to some of the classic names that have been out there for years. It's really some technology. Up above, cable television override is a big deal in healthcare, because no doubt you have people sitting in waiting rooms that are watching the health channel or CNN or something, or they're up in a patient room, and they're clueless. They have no idea what's going on, but we can enable you to send your messages and overtake those television screens and do the same with digital signage just up above it. We see more and more hospital and healthcare systems that are deploying digital signage, and that becomes another endpoint. And in the green center circle, those are various pathways that we can transmit over, including to mobile radios and to pagers. So there's quite a list here. So when we first started off with Mike and Daniel and Bret, they saw all of this capability, and they had to go through their own decision process as to what would make sense given their individual needs, and they'll get into that shortly. We can switch. Again, if you have any questions, as Charisse mentioned earlier, please use that browser box over on the right side so you can type in your message and or question, and we'll get to it later. Our first panelist is Mike Ward. Mike has been with us on board for several years now. He's using a lot of the Alertus platforms. The thing that I'm guessing that Mike is going to focus on, and we had this discussion way back when and again recently, is how do you get started with an emergency notification system? You know, and you have to get into the things that Mike had to consider and all that. So I'm going to turn it over to Mike and let him tell you more about what he went through, and then when he's done, we will move on to Daniel Anderson as well. So Mike, you there? It's all yours.
Thanks, Peter. Sure. Well, Anderson Hospital is a community-based hospital. We're located in the metropolitan area of St. Louis. We see about 90,000 patients annually. We have about just over the 150 beds and about 40 specialties. And so, as Peter was saying, I just wanted to take talk a little bit about what we did to get where we are today. And I was going to start with our emergency preparedness team. So on the next slide, what I have here is a graphic a little bit about how we had things structured, and that structure really hasn't changed over the years. So the team works mostly because the individuals that we have on this emergency preparedness team all have a personal interest in emergency preparedness. So as most hospitals will have, they have an environment of care committee, and part of that we have an emergency preparedness subcommittee. That is chaired by our director of EMS and emergency preparedness. That chair, he's a former paramedic, also a nurse, and the chair of our environment of care committee is our administrative director for our facilities, and he tends to have a freak knowledge of all things regulatory. So the administrative director participates on this subcommittee. Obviously the director of emergency preparedness. We have the director of security. There's myself on this. We have the director of our emergency department on there, and I mean, while the CEO is listed there, he's not somebody who actively engages in it, and nor does our chief nursing officer. But I have to tell you that they've always been 100% supportive of the team's efforts. So having drills or participating in community exercises, that's never been an issue for us. So we're very thankful for that. Back to the subcommittee though, it is it's open to all directors, managers, supervisors, or their designees. So from a team composition, I don't think we could ask for a better makeup for this team. But that's not to say we didn't have any challenges along the way. So if I could have the next slide for a moment. We had some logistics issues. Our switchboard has one operator at a time, and they monitor most of the alarms. These are all the static alarms that have the legacy type connections. It's all hardwired into that location. So for bathroom breaks are a problem. Our operator says, she can only go to the bathroom half the time, or and don't even think about going number 2. But in addition to that, when some type of event happens, we have a lot of people who will call in wanting information about what's going on. We have an overhead paging system that everything's connected to it, or to it's all one non-zoned paging system. So whatever you say in one end of the building is heard in the other end. And then we also have some regulatory concerns that we had, where back to our administrative director, and I guess some of you fire guys out there tend to be a little bit neurotic about the life safety code for obvious reasons, good reasons, but it created some challenges in trying to do some upgrades. So if I could have the next slide. And just a little bit about how IT kind of got involved into this. In addition to being the IT director, I work part-time as a police officer in one of the metro area towns, and spent a lot of time with responding, obviously, to different emergencies. But from an IT perspective, kind of just trying to bring it together of how I kind of, became more involved in this, is that IT tends to have a mindset of where we have to work with downtimes, backups, business continuity. So from a hospital perspective, we have 3 internet providers that provide connectivity for us to the outside world. We have 2 telephone companies to provide us phone service. We have a lot of redundancy there. So we're kind of always focused in that space. But we also have that technical understanding. We know that right now the current trends are towards the IP protocol. We have the Internet of Things, but we still have legacy equipment here at the hospital, and I think that's because there's a comfort factor with that. But a lot of that legacy equipment, again, is in that migration stage to an IP environment. The other thing is that we have to have that willingness. We've had that willingness rather to think outside the box. IT spends a considerable amount of time working on analysis, lean principles, just how to make things better. We were so how were we successful? I think part of it was going back to that subcommittee. There were just repeated discussions of the same thing over and over, and everybody, I think, understood all of those issues. But there just weren't the resources that were out there, that were made available to us. And then the Joplin tornado happened, and several of us went to Joplin and heard the postmortem. It was a great presentation, day-long presentation, of where it got many of us thinking we just haven't done enough. And part of that, and listening to the folks in Joplin, was just realizing that time is so critical in the first few minutes. And for many of us that are out there that are out in a first responder, you understand that the fog of war, the information's not always accurate, or you don't have the ability to communicate as well as you could. So what I kind of learned was that, I get a little tired of hearing about, we'll talk about something, and sometimes it's just easier to ask for forgiveness. So we kind of started off a little bit small with our notification system. We began to add components, and we created a lot of complexity with that. And I think because of that, we found that using the Alertus system as the core of our emergency notification system just brought all of those complexities and have you to teach them from an IT standpoint. Teaching the complexities of some of this to the IT staff wasn't so much of an issue, but we weren't the frequent users of the system. It were folks that were switchboard operators or nurses or house supervisors, people that just don't really think of this on a day-to-day basis. So, but I think all these things brought together, all these things happening, I think made us, got us to the point we are today, because the team finally understood. We were able to use many of these events to get where we want. And if I can get the next slide, just some things that you might consider if you are trying to put together a plan and struggling with that. I think we were successful. From IT standpoint, I kind of have some of the deep pockets. Some of our projects we cost a lot, and as at the end of the year, sometimes there's a little bit of monies left over that I could use to put to this. But so I would say, if you're going to find somebody in the IT department, maybe if they're too high up on the chain, they might not care about, this. They might not take emergency preparedness as seriously as you want, and they might squash your request. But if you go too low on the chain, they might not have an authority to get it done, but they kind of have resources that I think you could use. I'd say, we started off small and let the system prove itself. We started with just the desktop notification. And once that was in place, everybody said, well, could we do this? Could we do this? And because of all those previous conversations we had in our subcommittee, we were like, sure, it can be done. This is what it will take to get that done. And I think, we had to have a good understanding of the regulatory requirements. While our administrative director has a great knowledge of all that regulatory stuff, I didn't. And it took me a while to get up to speed on all the environmental care or all the life safety codes and just beginning to understand it. But once I did, I was really able to use that to the advantage and pushing our processes, our needs forward. So hopefully that's a little bit of how we were successful with it. I do think it was a lot with the people and the dynamic, but maybe those are things that you could consider with your team. With that, Peter, I'll turn it over to you.
That's great. Thanks, Mike, for that. Appreciate it. And I'm just wondering if you're, and maybe we could discuss this at the end, if any of the panelists would be amenable to maybe an email or something at a later date in case somebody has a question and wants to follow up with some of the points that you made. Okay, so Daniel Anderson, Ann's been on board for several years with us. He inherited a department out at Shawnee Mission, which was very scant in terms of resources, and both he and that department under his leadership have grown considerably. So we'll turn it over to Daniel. All yours, Dan. Thank you for being here. Appreciate it.
Thanks, Mr. Lester. I kind of ditto what Mr. Ward said. We're here in the Midwest as well in Kansas City. Next slide, please. Thank you. So we're in Kansas City. Our main facility is 504 beds. We have multiple locations across the Kansas City metro area. So one of the issues that we found was trying to communicate to all those properties. So the 504 beds is just the main hospital, but on that hospital we have 10 campus medical buildings, and we could not communicate effectively to those. Next slide, please. So some of our challenges was making sure our mass communication layers, we had large holes where we just weren't pushing communication effectively. So we couldn't ensure that we had 100% coverage of whatever that emergency message was. Additionally, I couldn't tell you if someone acknowledged the message as well. Did they get that emergency message? How much of our campus are we truly touching with that message? And then, the common conversation that we leave out a lot of times is, are we touching our visitors, our contractors, and especially our patients who are paying our house bills? So one of the things that we want to elaborate with that, and what I found with desktop notification, and I'll get into that in 1 second, was just the severity of the message. What we've found with Alertus is that there was multiple layers of how to produce a severe message, and with the systems we had in place, it was usually just a mundane message. It never indicated how severe the event was. And then the addition with that is the system maintenance. It was out of control. I could not control effectively what the system was doing from the different systems we had. So next slide, please. My heart and soul is with the Alertus desktop notification. I absolutely love how this thing works. And what I mean by that is, in healthcare, and especially at our facility, we're computer-centric. Majority of my staff members are behind a PC, and so we weren't really hitting that thing effectively to send them that emergency message. We had a legacy system which did what desktop notification does well, but it did it poorly, and we couldn't get a report on what it was pushing out, and we couldn't manipulate it any different ways of what the severity of the message was. And that's where I like the desktop notification is you can do a full screen alert, a ticker tape, or what I call little pop-up messages, where we use that daily. And so what we found is when we're trying to push out these multiple layers of communication, so we're thinking our overhead, our mobile phone pagers, which are SMS pagers, our nurse call pagers, and then with the addition of Alertus, when we look at that, we said, hey, the overhead page, while it's great, but uniquely you have to be underneath the speaker to hear it legibly and clearly. And what we found with the desktop notification is if you're in that area, you may have missed the immediate notification, but you can still walk up and see and say, hey, this is the message that's being pushed out to us. So with desktop, or Alertus in general, we're pushing 2 to 20 messages a day. And my common theme when I talk about mass communication is, you have to find a routine use for this system, or you're going to forget how to use it on the day of the emergency. And that's where I tie back to the 2 to 20 times of use with this, is we started pushing out our medical alerts, from cardiac arrest, rapid response, all these different things that are happening in our facility with our patients, where it's their emergency, we need additional care for them. And we also found that, with those caregivers, there was a lack of communication to them. There was always the common question, what was that? What was that message? And so when we started pushing out these desktop notifications for that, they got the understanding and the knowledge that they could look back at their computer and say, this is the message. Does this affect me or doesn't this affect me? And so with that said, so we just do the pop-up with our medical alerts. Well, our PBX operators, like Mr. Ward was saying earlier, they're kind of the focal point of reception for, pushing out these alarms and alerts. And so they've ingrained, Alertus is daily for them. When they come on to shift, they know exactly that they have to go log into the Alertus platform to say, I'm ready to receive the next alert so I can push it out, whether it be a medical alert, or today we're doing a disaster flu clinic, so we're doing a ticker tape for our dispense assist. All they do is click on the link and it takes them to the right web page to fill out their information, and then they can go get their flu shot. Or a couple weeks ago, we had an infant induction alert. And so there we took over the full screen. We gapped their knowledge. We took a hold of their computer and said, this is the thing that's occurring right now. I need your attention now. And so we were able to push out that potential infant induction alert. And we didn't lose any babies. Please don't spread that. But we were able to get our staff to immediately respond, and provide coverage until we figured out what that incident really was. In addition, we also utilize the alert beacons, and as Peter was saying earlier, we're trying to put those and add more and more to them, to our lobbies, our communication deficit areas. The lobbies are there's no computers majority of the time. There's not generally a staff member there sometimes. So how do we concentrate and talk to our patient and/or visitors that are in that area when there's no staff member to relay that information? So, we use the beacon on those true emergencies, a tornado warning, when the tornado's heading our direction. We used it this past summer when we had tornadoes heading our way and had to evacuate certain areas. So, and then the easiest thing of this is the system maintenance. Once we got working with the support team and really figuring out what our IT system, how they code and name our computers, I'm able to tie rule sets for our preset alert notifications. So I'm not always touching every PC, the 3,000 plus. If I can tie them together with a department name, it groups them uniquely, and then every time we add or change a new computer onto the system, it just makes so much less work for me. All the IT does is just input the computer, Alertus sees that that computer's on the system, and it's already automatically in a rule set. It knows that if I'm on this nursing floor, then I get these set alerts, or if I'm at this location, whether it be the main hospital, a medical campus building, or another one of our locations off-site, we can differentiate between the two different messaging and message types that each one are getting. Mr. Lester?
Yep, I'm there. Okay, yeah, Daniel, thanks very much. Appreciate that. It reminded me in terms of a couple of things that I wanted to say. You had mentioned the alert beacon. One of the things that Hopkins is doing is they had a need to make sure that people that were in OR were being informed. So in addition to being able to set up groups, as Daniel just explained, that could receive desktop notification, you can also set up groups that do not receive desktop notification, because obviously in OR, you don't want your monitors to be overtaken. So what Hopkins is doing is they're using the alert beacons in OR. They've muted out the audible, and this way people in OR will quickly get the same messages everybody else is doing, so that they are as informed as well. The other thing that, yes?
Let me add one thing on that too. So that's one of the scale of flexibility with the system is you can alert one computer or one beacon or the whole fleet or 10, 20, it doesn't matter. So even with our medical alerts, we're not alerting the C-suite with every activation. We don't want them getting mundane messages that don't truly apply to them. And that's one of the benefits with this system is we're able to segregate who gets a specific message versus the other. So sorry to interrupt.
No, that's great. I'm glad you did. Thanks. The other thing that Dana reminded me of is there may be some of these areas where you don't have overhead paging. And I will tell you that the Director of Emergency Management for Hopkins told us when they assessed the active shooter event that overhead paging was useless. They have a very good bogan system, but the noise that rose from the public who were so panicked about what to do, you couldn't understand what was coming over the overhead paging system. So one of the conclusions Hopkins had was that they will have audible and visual notification. In areas where you do not have overhead paging and you would like to have that capability, we do have a speaker that is built in, that has built in our text-to-speech technology. And when you combine that with a wireless beacon, you can put overhead paging in areas where you don't have to pull cable or wire and eliminate those costs. All right, so you've been looking at this handsome guy on here, so it's time for Bret to kick in. Bret, we went down and made a presentation on just the basic Alertus system 5 years ago. And Bret's lights went off and said, hey, if you can do this and you can do that, why can't you do this? And I'll turn it over to Bret in terms of how he expanded the Alertus product line. Thank you, Bret.
Thank you very much, Peter. Good afternoon, everyone. Thanks for taking the time and listening to this presentation. I love Alertus because Alertus solved a problem for me. Next slide. North Carolina's healthcare system is a large multi-hospital system in North and South Carolina. We have approximately 14 facilities within a metro area of Charlotte. And as a way, healthcare facilities are always challenged with reduction of FTEs, right? And as a way to do that, our system came up with an operator system. So when people would dial the phone, all the phones would ring to a commonly manned telephone operation location that we called the 801 McDowell because that was the address. And you would get the operator, and then she would direct you to the appropriate hospital or physician that you needed to reach. Combined with that, as in most hospitals, your on-site operators used to perform and probably do perform multiple functions. I think we heard Mike say where his operators would perform other functions, and one of the functions that a lot of them perform is the manual overhead paging process. A way to take that away from them is, especially when they went to an operator system, is they set up an on-call process at our 801 center that was serving as a receiver of fire alarms. Because in the healthcare industry, we have what we've referred to as, and yes, Mike, I am one of those fire geeks that knows the code, and part of that code is you don't really want to evacuate your healthcare facility. We defend in place. But to defend in place, you have to have an emergency response notification process where you send your response team to address and investigate any type of fire events. That was being done remotely. So when a fire alarm panel would go off at a facility, it would go to our 801 telephone switchboard operators. They would see the alarm. They would dial the appropriate extensions to reach the overhead paging system, and they would page whatever alarm they were receiving. And then they would also send a group of emails to an email, and then they would also send something that was what was called Zetron, which is actually the old Motorola pagers. And believe it or not, we still have physicians that like the old Motorola pagers. And so that old technology, even though we have a lot of smartphone devices now, is still being used in some applications, especially for paging and emergency notification. Well, as a result of an event that occurred at one of our facilities, we had maintenance call in of fire alarms or call in to the paging system and say, look, we're doing some work on this system. Don't call a fire alarm if you get a smoke detector. Murphy's Law had it that a kitchen fire occurred at one of the deep fat fryers, generating lots of smoke. The fire department came because the suppression system for the hood automatically dialed the fire department anyway. While the fire department's arriving on the scene, they're starting to vent smoke and put the fire out, and they hear an overhead paging operator come on and say, please disregard the alarm, this is only a test. So needless to say, that was the trigger event to realize that we had a problem. When we got into this, next slide, we did a flow process chart. And I don't expect you to read everything on this, but you know, that was the flow process, right? All those red boxes on the left are fire alarm devices. And then you have Simplex, which is the monitoring company. And then you have University, the actual facility. Then you had 801 McDowell, which is the overhead paging operator. And then you had alarms eventually getting to the fire department. Note that the black lines all represent automated systems. That means the alarm is generated by a device, and it is communicated through an automated electronic system, and eventually would work its way to the appropriate authority having jurisdiction. Note the fuchsia or pink colored lines. All that spaghetti graphing there is a manual process. And so that was my challenge to Alertus. We knew what Alertus could do with regards to mass notification, but it's like, Peter, we needed Alertus to use that mass notification technology and create an automated process for fire alarm mass notification. And that's what Alertus was able to come up with us for. And the way it works, next slide, what we did, what Alertus did for us is they took their backbone of their mass notification system. They come off of the fire alarm panel through an RS-232 output printer port. So all fire alarm panels can have a printer capability that prints the alarm. And that code that is sent out through a dot matrix printer is what Alertus has a module that's capable of receiving that information, looking for the alarm information, and disseminating that information to a server that will convert that to an alarm. So it leaves the fire alarm panel in a coded message. And one of our biggest obstacles was a fire alarm panel has 24 character limitation for the available number of characters you can have in naming a device. And that device character limitation results in creative abbreviations. A good example, you might have the number 1 ST FLR KIT SD. And a lot of our times, the operators, the manual operators that were seeing that alarm, they couldn't even understand that abbreviation. But what Alertus did, Alertus had a smart memory technology, and also a 900-character library that we built from all the abbreviations that we used in our system, so that it would recognize ST as first, and FLR as floor, and SD as smoke detector, and KIT as kitchen. So what it does is it takes that truncated message and converts it to a plain text language. That is the first big bonus that we got from Alertus, because now we had the capability of automatically creating a plain text understandable language coming from that fire alarm notification device. That signal goes into our local area network that then goes to the a server. We started out with actual hardware servers, and now my IS folks are actually using a virtual server off the backbone of our IS system. Works the same way. I don't see any difference. But then it goes from that server and processes that message to the LAN, and it sends it out through multiple means and modals of communication. The first one is the Alertus beacon, and you've seen that mentioned earlier, and that's a normal functional use of sending and disseminating a message, although I don't use that Alertus beacon to send a message to people because it's usually in a telephone switchgear room where my overhead page amplifier is. And what that beacon will do is when it receives that alarm, it will send it to a text-to-speech module. It converts that message to a text-to-speech. It seizes the overhead paging amplifier, and it will actually make a voice page saying, facility alert, fire alarm, first floor kitchen smoke detector. So it takes that abbreviation and it actually does the manual overhead paging for us. It seizes the overhead paging system and sends that message out through the hospital. Now it also has the capability of sending that device through text, through a smartphone phone number, an email to a smart device or computer terminal. And the most important one is Alertus created a switch and an encoder that will allow us to send that message through a Motorola Zetron paging network. That basically is a radio antenna on the top of our highest facility here in downtown Charlotte. And so through all these this multimodal forms of communication, we can rapidly disseminate a fire alarm event in a given facility to the right people, the response people. We were averaging, when I started getting into that manual process, throwing out all the anomalies like a computer reboot that would take probably 5 minutes to do an overhead page. Throwing all that out, we had an average overhead page time of 172 seconds from the time the alarm went off until you actually heard a voice over the speakers. We now, with Alertus, we have a 3-second response time. Now, we also built in, at the permission of our AHJ, we built in 15 seconds of strobes and horns sounding simultaneously. Our AHJ says, when the fire alarm first goes off, we want the horns to sound for a minimum of 15 seconds. So what Alertus will do is, Alertus has a built-in delay. Our fire alarm panel has an automatic silencing clock, and when that alarm goes off, the horns and strobes will go off. The horns will sound for 15 seconds. They automatically silence, and Alertus will then begin paging, facility alert fire alarm. It does it 3 times in a 45-second period, and then it will continue making that page every 2 minutes until someone hits the reset button on the fire alarm panel. So the Alertus system recognizes when I reset that particular alarm. Another feature of Alertus is if I have multiple alarms, which under a real fire scenario you can expect to have. The first alarm might be a smoke detector. The second alarm might be a pull station when somebody goes into the room and realizes it's a real alarm and pulls a pull station. And then I might get a third alarm with a water flow alarm. If the fire grows big enough and sets off sprinklers, I'm going to get simultaneous alarms. So Alertus will track those alarms, and we'll say the first alarm would go off and say facility alert smoke detector. Then it would go off again once a second alarm comes in, and it would say facility alert, pull station for alarm originating at the smoke detector. And then it would do the same thing for any water flows or any other subsequent alarms. So it's a really intuitive system that uses its technology to interpret what the signals are coming from the alarm notification devices, converts it to a plain text language, and can disseminate that in a multimodal form of getting that message out to the right response personnel that are going to address the situation. So it really was a solution that Alertus provided us for this automated fire alarm, overhead paging, and mass notification to replace this very cumbersome manual process that we were using. I'll throw it back to Peter.
Yeah, thanks, Bret. You know, I have to say, you know, not being a technical person, when I go down to Carolina Healthcare and I see what Bret and the IS guys and Alertus have done down there, it's kind of mind-boggling for me, because you could be on the 10th floor of a building and a fire panel activates, and it does exactly what Bret just described. It picks it up, it converts it to normal English, it sends it out, and you know, there are fire panels all over these buildings, as I'm sure all of you have. And it's just amazing that it can pick up an activation from any location and do its thing. So, Bret, I appreciate the insight on that, and because of the work that. Yeah, go ahead.
No, I was just going to say, you mentioned earlier, my motto is always, when in doubt, give Bret a shout. So I do hope that you share my contact information. I'll be glad to speak to anybody that's on the call that if they have any questions after the presentation.
Yeah, no, that's great. I appreciate. Yeah, that's nice. I appreciate you doing that. So anyone out there that wants additional information, make sure you get hold of our marketing people, and they'll in turn get you in touch with any of the panelists, or me for that matter as well. So I appreciate that very much. What I'd like to do now, I think we've got maybe about 10 minutes or so left, is turn it back over to Charisse to see whether or not any questions have come in, and if so, we'd be happy to address those. So Charisse, how are we doing?
All right, thank you all. We are now beginning the Q&A session of our presentation. If you have a question, please submit them through the chat or question box. Please note, if we do not get to your question during the session, a representative will reach out to you to answer your question directly. A recording of this webinar will also be shared with you after today's presentation. Now let's begin with our first question. As you know, HIPAA requires that patient information must remain secure and confidential. How does Alertus manage this?
Boy, I'm glad someone asked that. By design, we do not touch, store any of the patient healthcare records or information. We stay away from that so that we are not under any kind of HIPAA regulatory response or activity. We don't touch it, and that's makes it simpler for everybody. But a good question, thank you.
Next question, we have some areas where we have no overhead paging nor anyone at a workstation. Is there some way Alertus can help get alerts out in that situation?
We can in a couple of ways. Since we integrate with any of your VoIP vendors, and they have that audible capability, we actually have some hospitals that are using VoIP handsets in order to put an audible message in an area where you don't have anything going on just yet. Others were reluctant to do that because of the cost that I referenced earlier in pulling wire or cable. So that all you need is power, and you need a wireless alert beacon, and that is connected to our integrated overhead speaker, and voila, you have overhead paging in areas without having to face those other costs. But good question, thank you.
Hey Peter, this is Bret.
Yeah.
I'll chime in on that as well. One of the ways that we handled that was through our mobile devices. If somebody's not in an area where they would hear the overhead page or have the ability to hear the overhead page, we use the pop-up screens on the computers. But even if they're not at a computer, we can use their mobile device and either send an email to their mobile device or actually send a text message to the number of that mobile device. And then the last application that we've just started to recently use through Alertus is Alertus does have a phone app that can be loaded onto the phone, and then the phone will receive those messages through the phone directly without using the through the wireless communication, without using the phone system. So the application has been very valuable for us, especially when we have a larger number of or a larger group of people that we want to include in the dissemination of that information.
Yeah, sure. Yeah, good points. Yeah, thank you. Okay, Sharice, anything else?
Yes. Are the rule set groups integrated with Active Directory or other IT asset management solutions to manage the workstations that need to be in specific rule sets?
Yeah. In fact, I'm going to relay that question to Daniel. Daniel, are you on still?
Yeah, I'm here.
Yeah,
yes
great.
and no. It does have LDAP where you can tie in Alertus to that and have complete integration. So if you wanted to highlight a specific department, you can do that. The way that we've done it is just with our naming convention with the computers. So mine, for example, is SMMD, which is Shawnee Mission Merriam, and then the fourth character is desktop or laptop, and then the department's a 3-digit, and then the individual is a 3-number digit after that. And so what I highlight is the department over that, based on what specific rule set I'm putting into. So I have a hospital all notification, so if I want that department notified when a hospital all message is going out, then I highlight that department. But you can also do the same thing with LDAP, say based on user login, specific person, so on and so forth. And you can also do LDAP with the console login, where you want specific people, in case you have an issue with passwords or any numerous things, but there's multiple different ways of logging into the console with that LDAP configuration as well. I hope that answers the question.
Yeah, no, that's great. I do know, two things. I do know that we interface with Active Directory, so if you've set up groups in there, we can mirror those groups for, easy construction of those groups, in Alertus. The other thing is I was on with a very large hospital system up in Boston the other day and learned from our technical folks that an easy way to purge smartphone numbers, things of that sort, people that may have left, no longer part of the organization, and also with changing any of the desktop assignments, that can be done very easily as well. So I share that. Okay, Sharice, what else we got?
How does the Alertus interface with the desktops on the network? Is it through Active Directory, or are the desktops treated as an IP endpoint?
You want me to take that?
Sure.
So it's the application software that you load onto the actual PC. You get that from Alertus, and when we're imaging new computers, my IT department, that's one of the pre-installs that they do before deploying it out to the network, whoever is the reception on that. And then that's where I come back with the name. If your personal computer will say, what's the computer name? It's Daniel Anderson's home computer. Well, that's where we put our naming convention as SMMD SEC 111, and that's how Alertus finds it when you do the install on the console. And we can go in deeper into the weeds in this, but if you want to hit me on offline, we can talk about it.
Yeah, great. Thanks, Daniel. Yeah, what we typically find is that a new client that's deploying desktop creates a test group, and they send the client software we provide out to the workstations, and they go through their testing and all, and then once they're ready to go, they do a global push of the client software through MSI or something equivalent to that, and a config file, and makes it very easy and very quick to get desktop notification up and running. Sharice, go ahead.
Okay. We have some buildings that are on another nearby campus. Would we be able to send alerts to them?
Yeah, well, it's interesting. We just had a call about that yesterday from a large system in Maryland, and they have a campus which is about 2 miles away from their main health system location. The answer is, so long as any of those other locations have network connectivity, yes, you're good to go. You can use beacons in those locations or desktop notification. Any of the other Alertus product can be activated and deployed there. Okay. Next.
Can the desktop notification override EMR applications such as Epic to notify clinicians of a situation?
Yes.
Good question. Good question, Daniel.
Yes. It's really simple. I mean, it just takes over the computer screen, and I hope people don't take that as a bad thing. When I think of mass communication, I don't want to leave people in the dark either. But just as easily as it popped up, it's really easily to push away. There's an acknowledge button. You click on that, you can resume your normal activities. Hopefully you're not doing that. You're acknowledging the emergency that's happening. So.
Yeah, good point. By the way, in healthcare, we found that okay. So in healthcare, what we
I was just going to add. Sorry, I'm stepping on you.
That's right.
I was just going to add that from our perspective, that acknowledgement, all this is trackable, so it's time, date, and stamped on who acknowledges as well. So from a fire alarm perspective, for our usage of Alertus, is I have a history audit trail of these events and who acknowledges and who doesn't.
Yeah, great. Yeah, good point. We find that most of our healthcare clients are only using full screen takeover in a very severe event like an active shooter. Otherwise, nurses and doctors are working with patients all the time. They prefer to use a scrolling ticker either at the bottom or top of the screen because they want the patient record to remain open and interactive, and we have that capability for you. Go ahead, Sharice.
I would add, it also doesn't work, or it doesn't mess up anything that you're doing. You know, it's not going to corrupt a Word doc. It's not going to corrupt the patient files by any means. It's just an additional window that pops up. So, I mean, there is no issue with workflow by any means.
Yeah, good point. Thank you.
Thank you all. We have now concluded our Q&A session of our presentation. Again, if we did not get to your question, we will directly reach out to you with an answer. If you have any questions or need additional information, please feel free to email marketing@alertus.com, and we will be happy to assist. If you are looking for more information on Alertus and our solutions, visit our website, www.alertus.com. If you are interested in upcoming webinars, please visit alertus.com/webinars to see the full schedule. Thank you for joining today's webinar. We look forward to meeting you again soon.
Yep, thanks everyone.